All right, Dr. Blakely, for patients out there that have NF2 or they think they have NF2 or they just have a lot of tumors, how, do I have schwannomatosis? Where is the breakdown? What should I be asking my doctor?
So the very first answer is yes, you need to find a physician who has an interest in understanding neurofibromatosis type 2 and schwannomatosis, or is ready to go on that journey with you to research what it means to have either diagnosis. Neurofibromatosis type 2 has very clearly delineated diagnostic criteria, and the major difference between neurofibromatosis type 2 and schwannomatosis from a clinical perspective is involvement of the intracranial compartment. So inside the brain are there tumors. And if there are not tumors inside the brain, then that is more likely to clinically be consistent with schwannomatosis. Part of what was done at this strategic planning meeting hosted by Children's Tumor Foundation was to try to even further delineate the diagnostic criteria for schwannomatosis, because there are very rare instances where someone can have what's called mosaic NF2, a form of NF2 in which all of the blood cells don't have the NF2 mutation, but certain other cells in the body do, and that can be very difficult to diagnose, and it can look a lot like schwannomatosis. So the criteria as we're looking at them are to see if we can use what we know now about the genetics and about the molecular features of tumors from neurofibromatosis type 2 versus from schwannomatosis. And so to further delineate that, a patient would want to work with their physician for having their tissue tested for these mutations that we know to be specific to NF2 or specific to schwannomatosis. And that again would be a partnership with your physician to accomplish that testing.
Excellent. Thank you very much, Dr. Blakely.